It's been called the flu-nami, a wave of flu cases that's come 5 weeks earlier than normal, caused by a mutated virus called subclade K. Latest NHS statistics show an average of 2,660 beds were occupied by patients with flu each day last week in England, enough to fill 3 big hospitals. It's a 55% rise from the week before, and the NHS says it's facing a worst-case scenario for the time of year. Most of the cases at the moment are caused by the H3N2 strain of flu. It tends to cause more severe symptoms, particularly in the elderly. There's a version of the strain in this year's vaccine, and there are 2 other flu strains there too. But the decision on exactly which versions of the flu go into the jab is taken in the spring to give manufacturers enough time to make millions of doses in time for the Northern Hemisphere winter. But the H3N2 virus evolved significantly this summer to become subclade K. The 7 new mutations help it evade the immunity the population has built up from previous infections or vaccinations, so it's spreading rapidly. In a typical year, every 100 people with flu would pass the virus on to 120 others. This year, it's estimated to be 140. But the UK Health Security Agency says it's still 30 to 40% effective at preventing hospital admissions in adults. As for masks, well, the NHS's most senior emergency doctor says that's up to you.
I think at the moment what we're saying to everyone is to be sensible and pragmatic. So if you are symptomatic or if you are vulnerable, you may well want to wear a face mask, especially when you're out and about, and that would be a sensible thing to do.
The last epidemic was 36 years ago, when more than 1 million people were infected by Christmas. Then there were around 26,000 excess deaths. But even though infection rates are still only classified as moderate, cases are rising steeply, just as resident doctors prepare to strike next week. The Prime Minister urged the Doctors' Union to accept a new offer.
That offer can only go forward if they don't take strike action, particularly in the run-up to Christmas, particularly when we've got a problem with flu. It would be irresponsible of BMA to push through.
This outbreak and the likely impact on the NHS could have some way to go.